Hi there, this is a short video to help you understand what is happening in your body when you're feeling pain. So let's talk about pain. First, we need to identify acute pain versus chronic pain. Let's say you are working on your house and you hit your finger with a hammer. Instantly, your body recognizes that an extreme amount of pressure was present through tiny receptors in your skin, muscles, ligaments, and bones. Here's a hand, and here's a demonstration of the little receptor in your hand. These sensors feel the pressure and say, "Ah, this is dangerous," and send a signal up to your brain. The receptors in your finger don't know what pain is, they just know to signal the brain whenever there is a potential threat to the tissues. The signal from these receptors go up the spinal cord and into the brain. The brain is a central command center that makes sense of all the input the receptors are sending up to it. When you hit your finger, your brain tells you it hurts so that you'll stop using your finger and let the tissues heal. Once the tissues heal, your brain should stop telling you it hurts and you feel more comfortable using your finger again. Let's step aside. Have you ever had a painful or traumatic experience like a car accident? Or whenever you are in that area, do you have increased pain, anxiety, or fear? This is because your brain remembers these events and is trying to protect you. This is a good thing. Your brain is on your side to keep you safe, healthy, and alive. Unlike acute pain with the hammer, chronic pain will stick around because your brain really wants to keep you safe. Imagine your body is a house with an alarm system on it. Normally, the alarm goes off whenever someone breaks a window or opens a door. This is for your protection. Now, when the alarm system malfunctions, even a leaf brushes by the house and the alarm system goes off. Your brain is this alarm system, and it is guided by experience. When your brain is hyper-aware, thinks that the leaf is dangerous, your sensors in your body increase and become hyper-aware as well. This means that every normal bump or tap might actually feel painful, even though it is only something so light as a leaf. This is actually a physiological response that your body does to protect you, and we call this smudging. So how does smudging happen? The brain actually increases sensory areas that you use the most. So this means if you play a guitar, the finger receptors that are represented in your brain become somewhat larger than those in someone who does not play the guitar. This occurs when you're in pain as well. When your brain increases sensitivity to threats, the pathways for pain actually increase in size. This makes it easier for you to feel the pain. Your pain is ready to use the pain pathways. This also means that increased stress, fatigue, anxiety, and even negative thoughts can increase your feeling of pain. So let's summarize. Pain is a normal response to a threat or potential threat to your body. It helps you determine whether you should protect your body through pulling your finger away when you get hit by the hammer. Sometimes your body continues to tell you that there is pain, even though all the tissues have healed and no threat is present. This is called chronic pain. Together, we will help determine if your body is in acute or chronic pain. And if it is in chronic pain, we will work to teach your body that there is not damage occurring and that it does not have to be worried when a little leaf passes by your door.